Hi, I am Terry tonight, and this is Laura. We're going to talk today about botulinum, and not the kind that gives you lockjaw. A lot of people think botulinum toxin, which is what the generic name for Botox and Dysport is, and there's a couple of others on the market, Xeomin. We mostly use Dysport. But it's the difference between the two really is in how fast they work, and they last about the same amount of time. So Dysport works in about 3 days, Botox works in about 5 to 7 days, maybe take up to 10 days. So the way that Botox, Dysport, botulinum toxins work, it's a purified protein, so it's not going to cause lockjaw. It's not a toxin that you're putting into your body, although the name is called botulinum toxin. It's a purified protein that when injected onto a muscle, it saturates the receptors that get the chemical message to make the muscle move. So what that means is, so anytime we want to flex a muscle like smile or flex our biceps, there is a chemical message from the brain that goes to the muscle that tells it to flex. So when you put Botox or Dysport or some of the other products on the market, botulinum toxin, into the muscle, it saturates those receptors so the chemical message doesn't get to the muscle and the muscle doesn't move. So it doesn't paralyze the muscle, it doesn't numb the skin. There's a lot of misinformation about how these things work. But when we inject it in various areas, it's going to saturate those so it can't move. So right now you can see Laura raises her eyebrows and she moves and she has that nice surprised look. But as we age and we lose collagen in our skin and sun damage and several other things, the skin is more loose and so it looks more wrinkly. Now, a week ago, my forehead looked just like that, but mine is kicked in because I do this also. I'm 50, so of course I definitely look way more like a Shar-Pei than Laura does. I told her I wouldn't call her Shar-Pei on video, but I had to. Okay, so and then also when she smiles, if she wants, we can put a little bit here because it'll soften the crinkles around her eyes. They're called crow's feet. I don't like that name. It's kind of rude. The other place you can inject it is when you smile and you make a bunny face, if you don't like that. The key, and another question people ask, is how early can I start doing these injections? Well, honestly, the earlier the better because it's very preventative. So I've seen patients in their 20s that have really strong, this is called a corrugator muscle that makes that furrow, that 11 line, and it can create a deep permanent crease over time. So, there's no shame in starting younger. We're getting patients younger and younger, I think, getting this procedure done. So it's a tiny little needle in most cases, unless you have really thick skin, then it might be a little bit bigger. And then what we do is we just kind of map out. Now, I kind of like a more natural look. I like a more natural lift. I like to be able to move and have patients move, but some patients want to be frozen. So do you like Frozen? Not the movie, but a little movement. Okay. So, all right. So look at me and raise your eyebrows. And I just kind of see where her muscle line is and relax it. And I'm just going to go in a really quick little bee stings. This is called a matrix. And raise up again. Relax. Just like that. And in about a week, she'll be able to still raise her eyebrows, but these lines will be gone, hopefully, or definitely softened. Raise up one more time, relax. Just do a little bit more right there, it's pretty strong. Okay, all right, and that is Dysport.